Welcome back to the show and thank you for joining us. If you just tuned in, well, thank you for being here on a Sunday morning. And we're talking about hearing loss next. So it is quite staggering to understand that 1.5 billion people kind of deal with different versions of hearing loss at different stages. And here in Malaysia, the figure is at 200,000. So there's different levels of hearing loss, of course.
Yes, and it's something that I would say I take for granted, actually having these sensors, right? Because we don't really think about how it is to be as someone who has hearing loss or sight loss. But we're going to focus on hearing loss here because we have someone in the studio who actually lost her hearing at the age of 7, and she had to go through a whole year without hearing ability until actually becoming the first recipient of the ear implant, pediatric implant. She was the first pediatric implant recipient, and she's here with us. We were talking to CHYE, who is the Bionic recipient, our Bionic woman on set.
Right, absolutely.
We'll also be talking to Professor Dr. GOH BEE SEE, who is the Senior Consultant and ENT Surgeon from UKM Medical Centre. So welcome to the studio, guys. How are you feeling today?
I'm good.
Yeah. First of all, I want to ask, probably I'll talk to Lee first. CHYE, right?
Yeah.
Lee, I wanna check with you because, I mean, obviously, I've never gone through that experience, losing my hearing, and it must be a unique experience. And because you had to go through a whole year when you were 8 years old, if I'm not mistaken.
Starting from 8 years old is I found that I can't hear anything. Then I need to wait for 1 year, and then when I'm 9 years old, then only I take the operation and get the Cochlear implant, the sound processor to use.
How was the experience for you, Lee? Because you had to go through school at that time. How was it for you?
Before or after?
During that 1 year.
Okay, during the time that after I get the sound processor, right? So that when I go to the school, I need to sit in front of the classroom so that I can get more clearer what the teacher talking. Yeah. So then after that, when I want to talking with the classmate, right? Then if they say I can't get more clearer, right? I ask, excuse me, can you repeat again? Yeah, like that. Then after that, if let's say teacher is teaching, right? Let's say now it's etc. Then next is mathematics. Impossible. The teacher need to repeat again just for me, right? So if let's say I after the class, right, if I think this point I can't get, so I will ask the classmates beside of me. I will double confirm. Is it this one is correct or not? Yeah. Then in terms of activity, right? I can start using the light activity like running. For example, in secondary school or high school, right, we have the what you calling curriculum day, right? The first day is everybody need to run around the school. That one I can run, but the device I just put in the pocket, like that.
So there is a very minimal impact on your quality of life. And I would like to know about the situation that you went through because you were very young when it happened. It was a fever that caused the hearing loss?
When I was young, that time actually it's quite sudden. It's very hard to identify. Yeah, I just remember that I was like about 7 years old that time. I get the high fever. Then after that, I start thinking it's the right ear cannot hear. Yeah, then after that, from the 8 years old, just one day, it's very suddenly that I lost all the hearing.
Right. So let's understand what happened with Dr. Goh. Could you tell us how a child could actually lose their hearing after a long bout of fever?
Okay, in CHWEE's case, I think she had history of fever. It means there is infection. So infection can be nasty, where it knock out the hearing cells.
Wow.
And the sensory cells could not recover. So in her case, it does not recover. It didn't recover, and it affect the hearing level until become very bad. So that hearing loss in that stage are unable to be helped by using hearing aids. Because in hearing loss, you have to start with hearing device, and the first thing to do is actually to get your hearing test and to fit on hearing aids. But because the hearing level is so severe and profound, the hearing aids is inadequate to provide beneficial to her hearing level at all. So cochlear implant is the treatment.
So the cochlea is actually part of the hearing. It's basically our retina of the ear, if I'm not mistaken.
Yeah.
But let's look at the diagram that we have here. And Professor Doctor, could you explain how hearing basically works?
Maybe I can hold it.
Go ahead.
Yeah,
go ahead. Yeah,
please.
sure.
Okay. For everyone to know that when we hear, that this is our external ear, all right? And you have an ear canal, and there is an eardrum. And then you have a middle ear. There is inner ear. So in the inner ear, there is some structure called cochlear, a snail-like structure. And this is the hearing nerve. So hearing need to go through this pathway. The impulse subsequently pass through the nerve and then goes to the brain. So it has still need to be processed by the brain. So this is the cochlear. So she has the cochlear implant. It means that the functions of the inner ear is lost. And with the hearing aids, which is amplifications of sounds, is inadequate to provide the enough hearing. And hence, electrode is actually placed inside this cochlea. These are very tiny structures. The cochlea, and then it stimulates. It's the electrical stimulations of the hearing cells. And this impulse will be passed through until the brain hearing center. It is complicated.
It is. I mean, that whole area is very sensitive. That is the smallest bone in the human body, the ossicle bones.
Oh, yes,
It's
you
right
know.
there. And it is also another sensitive component of hearing. So anything can go wrong, especially if you play contact sports. You kind of understand how sensitive that is. But when we talk about quality of life after receiving an implant, Doctor, could you share with us how someone who has an implant can go back to normal, basically?
I think we should know that when you don't have hearing, the quality of life is badly affected. And not only in the individual themselves, but we do have our own study to show that the family members and the siblings of the individual who have hearing loss also being affected. Because you can't have good communications.
Yes.
Just imagine when I talk to you, now with mask, you need good hearing. If not, you will ask somebody to, no, what did you say? I can't hear you clearly. So you need good hearing so that you can hear clearly. When someone don't have good hearing, they can't have good communication. So you can't go, for example, for children, if they don't have good hearing, they can't have speech and language development. Then they are unable to attend school. They can't attend the mainstream school. If without this, they can't go higher, no, for the higher educations or to do something in future. So if you can have your hearing back, you should be able to hear like any other individuals. And nowadays with cochlear implant, the processors, they have something to cover. They can go swimming, they can play, sports activities. I have patients who are karate, they play karate. They're good. Taekwondo, they play music. So that will not stop them from doing anything like any other individual. So it's very important to get back your hearing.
It's a good thing that you mentioned about family support, because
Yes.
I'm sure that your family have been very supportive of you, Lee, because you were the first pediatric patient to receive cochlear implant. I'm sure they were the ones who actually started the whole procedure of you getting it. But how was the experience for you? Was there an adjustment period for you when you first got the implant? What was your experience?
Okay, let's back to the 1996. That time when I was first time to wearing, right? That time is I wearing this Spectra 22, the very first one. Yeah, this Spectra 22, right? That one is I can hear everything. So when I first time wearing it, I will be feel very shocked. Why? Because the sound that I hear through the machine and what I remember in the 1 year ago, the sound is totally different.
I see.
Yeah. So then, even the motorbike come nearby me, right? I also feel shocked. Why it's so loud? Yeah. So if they say the sound is so different, right? When I talk out, right? Then I myself I didn't know. My voice tone is totally gone. Yeah, it's not the same, not the correct one. Just my family tell me. They say, hey, your voice tone is totally gone. But this one, okay lah, they still can overcome by training myself. Yeah, I keep training. So then after that, because I'm staying in Malacca, then my parents, either dad or mommy, then they were off work and then bring me come to KL. We do the therapy.
Wow.
Yeah. Then in the therapy, right, the doctor will guide me that you try to not look at the lips, because when I getting lost that time, that 1 year I cannot hear, right, I will always look at the lips. Yeah. So then they train me, try to don't look at the lips, and then you try to listen, use the sound processor to listen, and then give response. Then they also guide my parents, maybe can try to use the phone call. Yeah, because with phone call, right, you don't need to look at the lips. So that time, right, is we keep practice, and then when back home, right, then my father was suddenly close his mouth and then test, hey, can you hear me? You get what I'm talking? Then I need to respond back. Yeah,
So-
then that time they also were like suddenly at my back, and then they call my name. Then I will say, hey, why? What? Anything? Then they will say, hey, nothing. Then I think,
They're testing you.
They want to test how fast respond am I.
That's good.
Yeah.
So in today's world, when everyone's masked up, how is the auditory process like for you? Can you hear us very clearly?
Okay. Back to the first time when I using, right, because it's the processor is just hearing all of the sound. It could be included the sound that in the air or the background.
I see.
So that time is I not hear quite clear. But now is when I change to the Nucleus Freedom and Nucleus 7, right? They can choose the program. The program they can choose either you want to hear all the sound, or you want to hear one-to-one, or you want to hear in one on the group. That one is I can hear more clearer like that.
So we're looking at some of the things you can do with the hearing aid, and how your life is pretty much normal. You can do everything that a person with normal hearing can, and that is amazing. Talk to us about this process of getting the implant in place. I'm sure a lot of parents will maybe in a similar situation that Lee was 7 years ago, trying to understand the risks and also the procedure. Doctor?
Well, I guess we should mention that when someone has hearing loss, how should they start the process rather than just go through the surgery? Because cochlear implant management is a team management. You need multiple professionals to work together to manage an individual with hearing loss, especially children. Nowadays, we try to make diagnosis early. But CHYE has hearing earlier, then she lost it along the way, at about say 6-7 years old. But if you imagine somebody who are born with hearing loss, they hear nothing from beginning. So what should they do? And I just mentioned that hearing loss management is a multidisciplinary team management. Hence, it means that they need to be assessed by a few professionals. The most important thing, we should look into the main core team members, for example, audiologists. You need audiologists to confirm the hearing level and fit them on hearing aids and optimize the hearing aids to make sure that that is the higher power, to improve the hearing level. So that is audiologists. They need to be seen, of course, by ENT surgeon to look for the possible cause of this hearing loss and to make sure that the ear, there's no infections to undergo surgery and it is safe to undergo surgery. We also have to arrange a CT scan and MRI. We need to see the structures of the ear and the brain, because there is about 20 to 25% from our local study. It shows there is from mild to severe form of abnormalities in the development of the ear structures that cause the hearing loss. So that is a scan. They must go through this process, CT scan, MRI. And do not forget, we have speech language therapies. They need to assess what is the child's baseline speech, as well as with hearing aids, what can they detect. We also teach the parents about this process. For children, development is important. So sometimes children may have other issues that affect not only the hearing and speech, but other cognitive. These are all important parts. So pediatricians are also part of our team. So we have to assess them. It's a team assessment. Then we come to a conclusion. Okay, this is a good candidate. The hearing aid is not adequate anymore, and they need to go for surgery. So this cochlear implant surgery is going through, as I said, we have to reach the cochlea, the inner ear, and place these electrodes, which is a very tiny, it is, the electrodes maximum is slightly less than 1 millimeter that enter the inner ear, the cochlea. So this process is called through the mastoid surgery, and reach the cochlea. It's very tedious and fine surgery. So it needs to be done by someone who is trained to make sure that the surgery is successful. So it's about 2 to 3 hours, depends on how complicated the case is. So that is usually the process before the cochlear implant until we make the conclusion that this is a good candidate.
I guess we gotta be thankful to technology for allowing this kind of procedure to happen. And of course, technology is always evolving. Sure. And I understand that you are now using a sound processor that's called Nuclear 7, if I'm not mistaken.
Yes, correct.
And it sounds like we're talking about a gadget here, Terence. Maybe you can tell us a bit about how different is this sound processor than the one before, and maybe what are the features? Are there features? Can you call them that?
Okay, can I pointing to the device?
Sure. Yes, go ahead.
All right. Okay. For the first time when I'm using this Spectra 22, right? As what I mentioned just now is the hair everything. So they are when changed to the this nucleus freedom, the second one. So this nucleus freedom, the difference is I can choose the program. Either is like all sounds still have, and then 1-to-1, and then 1 to the group. And then another one is music, but I seldom use. Then for this one you see this nucleus freedom that has 2 styles. Okay, first style is this one is wireless. So if wireless, that means that like I'm a girl, I like to wear the dress, right? So last time when I using this one, I want to find dress. I need to think, hey, is there any pocket that I can use? That but the got pocket, right? I need to think about it. Wire is come out, not nice, right? So now got wireless, so more easier lah. Then they can change to another style, which is this one is a body worn. You see the size is smaller than the original this one, right? So this one is very easier for activity.
Yes.
Yeah, so I always use this to run the marathon.
Wow, you run marathons.
Yeah. Okay, so now I'm using this Nucleus 7. This one is I just changed last month. So this Nucleus 7, you see, is more smaller, right?
Yes.
Smaller than this one. So what the difference is, you see, why it's smaller is because this freedom, right? The volume is controlled here, and then this one, and then this one, they not have the volume to control. So how to control is I need to download the app, the Cochlear app into my mobile.
There's an app for it.
Yeah, use the app to control the volume. Yeah, in the app I also can see the battery power, like that.
Wow.
And then the one that I very like for this one, the Nucleus 7, is they can auto switch on and off. Yeah, means that the bottom here is the battery. So when you let's say you plug off, is the switch off already. Then when you go to plug in again, then it's switch on. They will automatically. So it saves my time.
Wow.
In a way, this is already your Bluetooth wireless earphone in a way, right? Because you can connect it to your phone.
Yeah, for Nucleus 7, they can connect. They have the microphone, like what you're driving, like that one. Okay, they have a microphone. That microphone is automatically connect to my sound processor, then can connect to the mobile phone, also can connect to the laptop. That is called direct streaming. Wow.
And you can listen to music as well?
Sorry?
You can listen to music if you were to play music from your phone. Is that something possible?
Still can.
Oh my God.
Yeah.
I mean,
cool.
Yeah, you see, they changed the technology. They keep improving.
Yes.
Yeah, but then I just do one time only, and then I can use them in these 25 years.
wow.
I won't be surprised if like 20 years in the future it will be this small. I think that is very possible.
That is
and
very
that will make
possible.
your lives much easier. That's very good to know.
Yeah.
I don't know if you're familiar because we're calling you the girl with the bionic ear. There was a series about a bionic woman.
Yes.
I think we would probably know.
Yes, yes.
Kids, they don't know about this one. Her bionic ear was nothing like this. It couldn't connect to devices and do all kinds of interesting things that yours can. It is truly amazing how technology has come leaps and bounds. Doctor, for anyone watching this who is part of the hearing loss community and they're already familiarized with the world around them through the loss of sound, can they come in for consultancy? Should they?
They should. We hope that when they have hearing loss, they should come forward to test their hearing. There are times they don't even know they have hearing loss, especially when the hearing level is not the severe to profound. Sometimes in the school, we do receive referral from teachers. The teachers complain that the children didn't pay adequate attention, or they keep on asking the teacher to repeat and ask the friends to repeat. So those patients or those individuals may have hearing level which can be helped by using hearing aids alone. So I think we need to be more aware about possibility of hearing loss features in children, especially because they don't tell you. Sometimes they don't even know that that's important unless they can't hear at all. So we don't want until that stage. So nowadays we have newborn hearing screening. We call it universal newborn hearing screening so that we can diagnose them early. When we can diagnose them early, we call it 136. 1 month by 1 month screen. By 3 months we diagnose. By 6 months we intervene so that we can provide hearing from small.
Yeah, it's good to know that I guess if you're a parent with a newborn with this kind of problem, I think you don't have to worry much because we have technology to help us. And we can see it here in Lee. She's doing fine right now. It's been 25 years and it's great. Yep.
Thank you, Doctor, and thank you, Lee, for coming on. And to my brothers in the clubs, the DJs, the retired DJs, you may want to come in for hearing check.
Yes, I think you should.